Okay, so we talked about a few of the common conditions and problems that the elderly can be confronted with. And we just talk about, let's say, two of them. For example, the loneliness one, how do we avoid it? Non using of for example, mental exercises and so on that many elderly people no longer partake in. So, what do we do about that? And also, quickly, maybe we talk about dementia in the elderly.
Well, the reason why I didn't mention dementia very strongly before is that in this society, until proven otherwise, dementia is equal to madness.
Okay.
As far as
Or
we are
it's
concerned,
assumed to
it's
be
assumed to
a
be
form
it.
of
So
fun.
she's gone mad.
Mm.
Her wickedness have caught up with her. But it's something that I need to clear dismiss by saying that it's a myth. It's a myth. Increasing forgetfulness is very common in short, elderly person. But there's no one who will tell me that, say, from age 2025, you haven't had an episode where you got up from one room and say, I'm going to the other room to pick up something. And you enter that room, and it's like, what? What did I come to pick here? It's a common thing. It's a phenomenon that
So it
is,
does occur.
yes, it does occur, and that's a normal thing. However, it becomes a problem when it's having recurrent, it's when it's occurring recurrently and longer duration. The person comes out, go again, with other associated features of inability to take control of some of the things they've been taking control of, like their personal care. So you find the person is a gentleman, he's gone to wee wee, he's forgotten his flap. You can forget zipping up your flat once, but when you are going to chronically
Yeah,
forget
so when
it,
it becomes,
or better still, you're even already incontinent before you
yeah,
arrive. That's something
okay.
people have to look at. It's not just because you're demented, other things can happen, but we're looking at a combination of problems before you can start looking at, is this man dementing? Okay, daddy, all right, here you are, blah, 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 blah. Person gives you a thing, and then you keep it. And then you say, hey, Lewis or Paul, where are you? Yes, daddy, come back. Say, hey, where's the thing I sent you to go and collect? When that is happening often, that's
You
you
know
begin
that
to
something
you
is
begin to
wrong.
remove the
Yeah,
word increasing forgetfulness and start going towards is he dementing or
yeah.
something and other factors. Calculation, remembering the time of day, even remembering people say, oh, have I seen you before? Say, I said, but I was a student just 1 month ago. So were you?
Mm.
Okay, so what's your name again? Meanwhile, the individual will tell you about World War One and
Yes.
World War Two.
So it's for
So
recent events
yeah,
mainly.
forgetfulness, increasing
Mm.
forgetfulness. So that's I want to get that out of you. And I need to add three things before I stop talking about that. Please, if your relative is having such symptoms or more, and you're beginning to wonder whether they are dementing, please do not lock them up in the room, especially if they've started wandering, if they started having what you call antisocial behavior. You know, don't hide them. They are not paying the price of wickedness. It's an ailment that is involved in the brain, and from there can affect other parts of the body. There are increases of falling, there are increases of malnutrition, there are increases of infection. Don't hide them. It's wicked to do that. Please bring them out. Come to the clinics, you see the geriatrician, or you can see the psychogeriatricians if we have one around. Okay, so that's about the dementia and mental challenges. But the other one you asked about is this loneliness matter. What do we do now? I can't tell you percentage of mine, but quite a few people, maybe about 25% of people, have opportunity to have worked in pensionable job. Majority did not. The fact that you didn't work in pensionable job, that's public people, does not mean that life should be so miserable and you should declare yourself destitute before your time. No way. That is why I have this paper on my leg. In summary, in 2017, the United Nations, our former president, President Mohamed Buhari, complied with more than 42 policies and conventions that has said that other persons should be taken care of. Nigeria was there, their signature was there, but they didn't quite put it into an act. But 2017, our president, the ex-president, put it into an act, and it became enacted and came alive in 2018 when he proceeded to appoint a director general specifically for looking at and taking responsibility for coordinating the policies and whatever about older persons in Nigeria.
Nigeria. Okay.
So that is where the wonderful thing and life and turning around has happened for a lot of older persons. So what's the implication of that? I will give you a few. First is the fact that she ramified this existence instead of leaving it where it's domicile, which is Ministry of Humanitarian Disaster Management and Poverty Alleviation and Social Welfare of Abuja. It's been ramified down the 36 states
So
of the
the
Federation
various
plus the
states.
FCT.
Okay.
So we in Rivers State are not left out. So we have a division of this same thing called RISNAC. The RI stands for Rivers State. The S stands for the Senior Citizens, that's National Senior Citizen Center, Stakeholders in Aging Consultative Forum. You can see it's a very long name. So we coined it RISNAC in this part of the world, meaning RISSNAC, RISNAC. That is the body that has been approved to invite and digitally register as much as possible, if not all, persons who are 60 years and above in this state. And why do you want to do that? It's easier when we are in a group, doesn't matter who you are, no matter how rich you are. If you get benefits from the system, you don't need it, give it to your gatesman. Your gatesman can now educate his or her child. But people have to either have the pension as I agreed for them, or the non-pensioner ones, what we are calling more like a social pension. But the proper name is having we don't call it social pension, it has a sub name, but for easy discussion, I call it social pension. So people who are non-pensionable cannot be left. Everybody is carried along. Don't leave anybody behind. It's one of
So they
them.
have been given some form
Yes,
of
yes. So
allowance or stipend.
yes, the other advantage you have is that because we have that portal, it also gives us opportunity to catch. That is by catching mean by digital catching. I'm not talking about capture.
Okay.
Of people who are interested in having continuous engagement. So we have what we call continuous engagement bureau program portal. And what that means is that all NNS, National Senior Citizen Center, the abbreviation is NSCC, intentions declared. It is where we offer interested seniors who register and declare their interests and areas they wish to continue to engage their skills, experience, and expertise to be available and have placement opportunities to keep their interest going in the organizations of their choice on contract basis, or if they like, volunteerism basis. In other words, there is no excuse for any elderly
Okay,
person
to sit at
there
home and be
all day.
lonely.
They say, what is that? I'm old now. Old what? You're either coming out, still giving your skill.
So government want to engage
Yes,
the
there's a forum
elderly.
percentage of that
Okay.
now. You go back like you're a professor now, thank God you're doing this. Assuming you're not, what stops you? You go back to university, this scheme is there. It's a government policy. So that's one. The other thing, and this goes all through federal government, ministries, blah, 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 blah. The other thing I must add is that even if the farmers, the non-pensionable people, there's encouragement that in each state of this federation will have no less than 3 cooperatives specifically for people who are
For the
60 years and
elderly.
above.
Okay.
Because from there you can get a lot of funds, you can get a lot of support.
Benefits.
Yes.
Social
And yes,
interaction.
they call it multi-purpose cooperative. So you have the
Cooperative.
social interaction, the network. The other thing I want to remind you, of course, we are into that small and medium enterprises cost meter.
Okay.
We are not excluded. We are the ones using our hands to exclude. And I can tell you for nothing, at least since I took office as the chair, the first co-chair of managing this RISNAC, I can tell you, I know that there have been loan which is virtually not payable of 350. There have been loan of 500 to people.
The interest-free loan.
Yeah,
Okay.
virtually,
Okay.
completely. And anyway, we call it loan, but actually nobody has
So like
access.
a grant, for
Yes,
example.
it's more like a grant. That's the word. You know, and there is this social scheme where you take 25,000 and give to family of the older person. In other words, no older person should starve. No older person should be denied. And while we're there, where we encourage the cooperative as well, and it allows us to enjoy what we call gift ship. Giftship is a scheme where an elderly person who is not pensionable and their workplace is not taken care of, the family can pay or friend can pay 12,000 naira per annum for her. And that covers her health facility. If you are not registered, how can we pick you? You
Okay.
understand? The other things you can get in, as well is we are working with local communities and we're trying to build what they call the center of excellence that is mainly for elderly persons. Such centers will have the social angle where they can go and network. It will have the acute angle. For these states, I already have the package submitted to government. I hope one day to look at it. It will have the rehabilitation forum. It will have the educative forum. It will have the research forum. And also, let me not forget to say another wonderful thing is carer. The caring for elderly people are now being coordinated properly. I started this about 2019, soon after COVID. University of Port Teaching Hospital, I have been sharing it. I've been with my team working there. We'll be doing caregivers training
Okay.
formally. So there is no
So we
need.
have trained caregivers.
Yes,
Okay.
trained caregivers. Now the good news is that it's going national.
Okay.
And in short, we have got a slot within the higher education system to give it university or higher education certification.
Okay,
The
so
one we do here,
some
we have certificate
okay
as well, because we are doing it.
or that will be university diploma.
Yes, but
Okay.
now it's under the higher education program. So there is a lot of good things happening for older persons. So this is not time talking about loneliness. You have no business being lonely, because if you've been like I saw you super duper phone you are carrying, you retire but you're a professor, I know. But there are people like you. So because you are now elderly, oh, I better put up my phone and put it under my bed. What's going on? Because with that, there's networking. Snack, there's a lot of chats going on, a lot of information.
So you will encourage the elderly to participate.
For instance, now 23rd of no, 30th of November, we are off to have our end of year activity.
Activities
Sir,
also,
you're invited.
so people get.
You're invited, sir. Although you
Okay.
haven't registered, I'll register you if you allow me. So we come along. We are going to Pleasure Park. From Pleasure Park, off we are in a big, nice AC coach. I'm the head. I'm organizing it, and they're not paying a dime. So the little money we have in our pockets, instead of leaving it there for interest for next year, say let's take a little and have fun. We're going to a very famous menage restaurant, and we sit there like the fine ladies you are. We get started, we have our music, we dance, take photograph, cut our cake. What's going on? There has to be life. As you lay your bed, so will you lie on it?
Thank you. I think we will end on that note. Thank you very much, Professor Bergam. Um, I'm sure that the elderly will be very happy to note that most of these programs are available and they can participate in it in all the 36 states of Nigeria. Thank you very much. So the elderly should not leave themselves lonely. They should participate, to socialize. And thank you for coming. We are particularly grateful.